Hello, I'm Dr. Greg Winteregg, CEO of the Private Dentist Alliance. I want to talk to all of you students out there today who are wondering what your future is going to be like as a career in dentistry. As an assistant, as a hygienist, as a dentist, where is this profession going with the rapid increase of the DSO movement? I'm here to tell you that PDA is going to help you, and I want you to become a member today. It is free. Now, why should you become a member? You're going to get weekly video updates from me, and you're going to get regular updates of our newsletters from the Alliance on exactly what is happening and how we are going to help preserve and protect the private practice of dentistry. Now, to me, the most important advantage is you are going to get access to our job board. What is that? Our private practicing members all have access to our PDA job board, which means if they have an opening in their private practice of assistant, hygienist, doctor, front office staff, they're going to be able to post it. And you're going to be able to check up regularly. And as our membership grows, we're going to be covering larger and larger territories across the United States. If you are looking for a job in any position in the office of a private practice, you need to become a student member today. It is free. Go to www.privatedental.org and become a student member today. You're going to love your benefits. Do it now.
What is up, guys? It's your boy Matt Havis back at it with the Dental Student Vibes podcast. Today we have not so much an interview, but more so a lecture presented by, your very own Seth Calish, the head of the Vibe Tribe. He sits down at USF on a Zoom call to explain all things dental school, how to get in, how to apply, what your credentials need to be, all that sort of stuff for pre-dental students looking to start their application cycle. So check out the interview. I know it's not our normal style, but it was extremely high yield. He provided a lot of good information, gave a huge insight into the field of dentistry and everything that you need to know as a potential applicant. So tune in, let us know what you think. If you guys have any questions, comments, concerns, you can reach out to us on Instagram at dental.student.vibes. Give us a like, give us a share, tell a friend about it. We'd really appreciate it. And, in these crazy times, just stay safe and vibe on.
Let's get out of that. All right, so my name is Seth, Seth Calish. Like she said, I go to dental school. And first of all, thank you guys for having me. I love talking to future dental students, future dentists. That's one of my favorite things to do because this journey that we're all on has changed my life and it'll change your guys' life. Absolutely. I'm not even a dentist. I'm just a dental student, but this has opened so many doors for me and it's been such an incredible, fulfilling opportunity to be going on this path. So again, thank you guys for joining me. And like she said before, I also started Dental Student Vibes with a couple of my colleagues. It's a podcast. It's available on Apple iTunes, Spotify, all the major podcast platforms. We got an Instagram. We got a big Facebook group. There's several thousand students in there, and it's all about helping you guys become the top 1% of dentists. That's all of our goals, So a little about me. Okay, so I went to FSU, got a degree in biology, but then I went to USF and I went through the MSP3 program, great program, probably one of the most difficult programs I've done in my life. Got a master's degree and I have a lot of leadership positions now in dental school. So SGA vice president, I'm the business club president, yada, yada, ASDA, lots of stuff. Like I said, Dental Student Vibes, that's become a big part of our lives because we love giving back to all of these students who are trying to get into dental school right now. And it's 'tis the season right now. We're right in the middle of October, November coming up, and then you get your first decision day in December and then January. Also, author, speaker. I do some, that Instagram stuff, ambassador for Cherokee Scrubs. Also, I love bodybuilding. You got to stay fit, and dog dad. But most importantly, I want you guys to really understand that I was in your shoes right before I went through all of these things. So I know exactly what you guys are going through, and I want to do everything I can to help you guys get accepted to dental school. So, most important thing, dental school is what you make of it. So here's a bunch of pictures from the past couple of years. I'm a third-year student. Dental school is 4 years. We do all sorts of fun stuff. Honestly, a lot of people say the hardest part about dental school is getting accepted, right? After that, everybody really helps you the best that they can. And then, you do all sorts of fun stuff. So we go to birthday dinners, just do lots of fun stuff. But then we also go to conferences. That's the Florida Dental Association conference. There's me in SimLab. These are all my colleagues, and here's us at a business conference. So we love going to conferences. We love to have fun. That's what it's all about. So it is what you make of it. You got to try and get as involved as possible. Okay, so how do you become a dentist? So you guys probably know a little bit about this, probably a lot about it. But first of all, you must go to dental school. Some people don't know that. Some people are like, oh, what do you take an online class to become a dentist? No, you got to go to dental school. So how long is dental school? 4 years. And most of the schools are set up with 2 years of classes and simulation lab. We call it sim lab. So you do your didactics, you do anatomy, physiology, biochemistry, all that sort of stuff. But then you're also doing dental specific classes like prosthodontics, periodontics, oral surgery, those sorts of classes. And once you start getting into that, the dental specific material, you're like, wow, this is what I've been waiting for so long. And then it gets even better because the following 2 years, which I'm in right now, you start doing your clinicals and you start working on actual real life patients. And let me tell you, it is so much fun. It's so rewarding. It's also super difficult because there are so many little things that we see every day that you don't even realize how many challenges there are when you go into the dentist, how many little things that the dentists are looking at that you have to take in consideration. Especially, we're very fortunate to be able to serve a population that has a lot of dental needs. So we're able to do a lot of dental treatment for them, and we're able to gain a lot of experience. So I'm very fortunate for that. So how do you get into dental school? So this is just like every other professional school. You have to have a good GPA. That's always number one, right? So, got to study in college, can't fool around too much. But, you can also have fun doing dental specific things, doing extracurricular activities, volunteering, shadowing, doing research. These things can be rewarding, especially when you make them dental specific or in dentistry and you really feel like you're working towards your goals. So get involved, like I said, very important. The next thing you need to do is take the DAT. So that's just like the MCAT. So that takes approximately 1.5, 2 months to prepare. Some people take 3 months, 4 months to prepare. I tried that, did not work for me. I studied in 3 weeks and I got the best score that I took it twice and I got the best score studying for 3 weeks. Went to Panera every day this was years ago before COVID. And I would sit there for hours and hours and hours a day, bring lunch, drink lots of coffee. But you know what? You're grinding and you're hustling hard and you just got to realize, you got to picture what it's going to be like getting that acceptance letter. And my favorite quote, Stephen Covey, begin with the end in mind, right? So have a clear vision of what you want to do and where you're going to be as a dentist. Also, if you guys have any questions at all, feel free to just shout it out. Stop me anytime. Okay. So just like applying to med school, apply and ask the appropriate people to write you letters of rec. So these could be your professors. They'll also be the dentists that you shadow. And then also it could be some leaders in the community as well, but it's very important that you get to know these people that write you the letters of rec, because they actually do read them. And you can easily tell, is this generic? Is this not generic? We do a good episode on Dental Student Vibes about asking for letters of rec, giving the letter writer your resume, maybe some additional things about you, just material for them to write it. But also, you'd be surprised, a lot of times professors will be like, oh, you got an A in my class, you write the letter for me, I'll sign it. How about that? So the biggest thing is, everybody is afraid to ask. Do not be afraid to ask, because what's the worst that can happen? They say no? Okay, go to the next professor, okay? So you guys, we got a lot of great material to help you all out on Dental Student Vibes on the podcast. The next step, decide which schools to apply to. Now you would think like, okay, I'm just going to apply to all of them, right? There are 60 something schools in the high 60s. It's always changing. That's actually very important, because you need to understand, it's just like picking a college that you want to go to. Why did you go to USF? Why not somewhere in California or New York City or something like that? You need to be aware of what the GPAs are like at those different schools, of what the average DAT scores are like. And you can, of course, you can apply to your dream school, but it's also important to be realistic and know where you stand compared to the other applicants. And then finally, prepare for your interviews. So everybody is, very frightened of this part, but I think it's definitely one of the most fun parts, because first of all, you can treat it like a vacation. So one of the USF students, I think she graduated, but she's applying right now, is on multiple interviews. I know in COVID you don't get to travel around. It's all the interviews are on Zoom right now, but hopefully when you guys apply, that'll all be in the past. But when you are doing the interviews, you get to see what the campus looks like. You get to really get a feel for what the dental school is like. And that's very, very important, because, you're going to spend the next 4 years there. And then also, again, we have a lot of material on Dental Student Vibes about how to prepare for the interviews. We have a list of all the questions. So feel free to reach out. We have all the contact information at the end here. Okay, so prereq classes. 8 hours of biology, 8 hours of physics, 8 hours of English, 8 hours of Gen Chem, Organic Chem, all of these. You guys have all seen these. You've probably all taken them. But also be aware, again, when you're picking the schools, make sure that you know what the prereqs are. This is just a generic layout or list of what the prereqs are. All the dental schools are different. I swear, like some of them don't even require anatomy. So some of them require, what is that class called? Dental terminology. So make sure that you go on the school website, just type in wherever, let's say you want to go to Tennessee Dental School, or you don't even know, it doesn't matter what the name is. You can find the dental schools and then figure out what the prereqs are. Very important. And then another great thing to do, little tip for you guys, call the dental school and ask them, hey, does this count? Does this count? What else do I need to take? But just start getting in the habit of being in contact, because the more touches, the more touch points that you have with the dental school, you'll start to establish a relationship with the admissions, and guess what? You're more likely to get accepted. Okay, so let's talk about the DAT. So the DAT is a dental admissions test, measures your academic ability, scientific understanding, perceptual ability. So, this is similar to the MCAT. I think it's a little, it's different in different ways, of course, but the main difference is the perceptual ability, and it's kind of difficult to explain. It's more of like you have to show you sort of thing. But there's all these different visual tests to determine your perceptual aptitude. And it kind of helps you, especially when you're drilling on patients and you're looking indirect through a mirror. Like, I don't know if you guys have ever tried writing your name while looking in a mirror. It's very difficult the first time you do it, but it takes practice. So if you have any questions about the DAT, we have lots of resources as well, things to help you with the DAT. So what are the sections of the DAT? Natural sciences, biology, gen chem, orgo. Also, we talked about the perceptual ability, so 2- and 3-dimensional problem solving, and then reading comprehension, and then quantitative reasoning. And now there are specific strategies for each one of these. So there are specific resources that you can take a look at. Of course, looking at the old exams that the committees release for you to go over, super helpful because you'll see repeat questions. The way that I personally studied for the DAT was I just did practice tests over and over and over. I used DAT boot camp. I don't even know where they're at by now. They probably have some amazing new program, but I thought that that was a great program when I took the DAT. And then of course you have to practice the perceptual ability, and then there's specific techniques and tricks for each one of those. Okay, so when should I take the DAT? So when you completed the prereqs in biology, gen chem, organic chemistry, and it's recommended that you take it at least a year before you want to go to dental school. So I graduated from FSU, I did the master's degree, and then so in the fall of my master's degree was 1 year, I took it in the fall and during winter break. I studied during Christmas, lots of fun. And then I didn't like the score that I got, so I took it again the following year, and then I had a gap year. So you got to determine what do you want to do in your gap year. So during my gap year, I became a dental assistant. I worked in a dental office, huge dental office, and they actually love that. The dental admissions love that I was a dental assistant. So you know what? That could be an opportunity for you guys. All right, so how do you study for it? Review, study the key principles. You guys should already have taken biology, chemistry, and then take the practice test. So if you guys feel comfortable with all the material already, just go ahead and start taking the practice test. The first time you take it, you might get like a 14. And I would say competitive is in the 19 to 20 range. Don't stress, okay? You just got to keep taking it, and by the time you are ready to take the test, you'll be getting 20s, 21s, 22, 23s. Okay, ton more information on the ADA website. Okay, and one of the resources called the DAT Candidates Guide. And there's also a tutorial. All right, so let's talk about the dental schools in the United States. So they're everywhere, almost every state. There's 3 in Florida here. We have Leecom, Nova, and UF. Okay, so you guys have plenty of resources that you can Google and find out which dental schools that you want to go to. So again, I just want to throw in here another slide. I love putting all these pictures of the stuff everybody's done. Dental school is what you make of it. So here we have a picture of us at Project Christmas Smile, and that was a free dentistry day. And I think that that is one of the most fulfilling days. I love stuff like that, doing volunteering to those in need. You'll see people standing out in a line outside of a dental office at 6 a.m. waiting to get this free treatment because they're in so much pain or they're getting free this or that, you know. So I think that is so fulfilling. I hope to personally do that in my practice, like, I don't know, maybe even once a month. Like, that would be amazing. And then here's people studying. Here's more volunteering, doing pediatrics. And then here's everybody. Here's my class in their white coats with one of our professors. We all love him. He's our prosthodontist. Okay, so what does the dentist do? He's your primary care oral health provider. So diagnose, treat, manage your oral health care needs, which includes your gum care, root canals, fillings, crowns, veneers, bridges, preventive education. But some people don't realize they also diagnose cancer, treat infections. I was able to diagnose cancer the other day on one of my patients. Fortunately, it was benign, and I just cut the tumor out, and you know, she's okay, good to go. But it's also really about changing people's lives, because you don't understand that there are so many people out there that can't eat, they're in constant pain, when they smile or they laugh, they cover their faces because they're embarrassed. You have the power to change their life. So here's a classic example from Dr. Appa, and this is a model, and she had very minimal changes here. But I don't want to throw in the graphic pictures, but all you got to do is Google dental or teeth before and after, and you can find some crazy stuff out there. Okay, so how much does a dentist make? So a dentist makes, on average, or the median salary is about $151,000. It goes up to $200,000, and that is also just a general dentist. Now this is from 2017, and also most. I don't know if this statistic is correct, but I read somewhere that most dentists are associates, and if you're a practice owner, you'll make more money. If you own a group, you make even more money. But the important thing about this is you have to consider you're working very hard, and it depends what you want to do with your life. Do you want to have a family? But you need to feel comfortable, and you need to be able to live happily to be able to do your work well, right? And trust me, dentistry is a very, very, it can be very tough at times, but it's also very rewarding. So what is this? This might be in the United States. It might be different for Florida. So yeah, just take a look at the median salary for where you want to live. All right, so what are the different dental specialties? So there's, I think, maybe 9 or 10 or 11 or 12 now. It's always changing, but these are the main dental specialties. There's new ones all the time. Endodontist, that's the one who does root canals. Oral surgeon, orthodontist, pediatric dentist, periodontist, prost, and oral pathologist. So I'll go into each of these briefly. So endodontist. So concerned with the causes, diagnosis, prevention, and treatment of disease and injuries of the human dental pulp or the nerve of the tooth. So endodontists perform simple to difficult root canal treatments or other type of surgical root procedures. So this is a higher paying dental specific or dental specialty, and that's due to the low overhead. This is a really complicated specialty. You have to go to school. There's different residencies, but most residencies are between 2, 2, and 4 years. Some oral surgeons will go through a residency for 6 years, an additional 6 years. So that's for endodontists. An oral pathologist is a healthcare provider who studies the causes of disease that alter or affect the oral structures. So I told you about that patient that I had a tumor on her lip. So I took a biopsy of that tumor and sent it to the oral pathologist. An oral surgeon, or AKA oral and maxillofacial surgeon, provides many types of surgical procedures in and about the entire face, mouth, and jaw area. They also do implants. You guys might have heard of implants if you have shadowed at an oral surgery office or at a general dentist office. And then they also treat patients with the more aggressive tumors and cysts. They also, like I said, place the implants. And then you'll also be familiar with a lot of oral surgeons extracting the wisdom teeth. And then also treating cleft palate or lip repair. So, like I said, the oral surgeons can receive anywhere from 4 to 8 years of additional training after dental school. Orthodontists. A lot of you guys have been to an orthodontist. So orthodontists are the healthcare providers who specialize in diagnosis, prevention, interception, and treatment of malocclusions or bad bites, so aka braces. But there's also a lot of other treatments besides braces. There's a lot of different appliances that you might see at an orthodontist office. And I'm sure a lot of you guys have seen now, what is it called? Smile Direct Club. You guys have probably seen Invisalign. But are those really, or at least, the certain big brand ship in, ship out clear aligners, are those really to the best standard of care for your patients? I don't know. That's for you to determine. How about pediatric dentistry? Does anybody here want to go into pediatric dentistry? Maybe. So pediatric dentists, you guys might have been to them when you were younger. They provide dental care to children, and it's almost like a different, you would think you do most of the same stuff with children as you do with adults, but a lot of it has to do with behavior and how to make the child have a good experience at the dental office. Because the children who do not have a good experience at the dental office end up being the ones who, are too afraid to go in for their checkups, or they hear the sound of a drill and they freak out, So we want to make sure that we give the best care possible to the children so that they have a good experience and they have good memories and they're able to have the best dental care in their future. Periodontists, you could also call them gum specialists. So they help and they specialize in diagnosing, treating, and preventing diseases of the soft tissues, mainly the gums, and supporting bones of the teeth. And they also treat gingivitis and periodontitis, and they do all sorts of procedures. These are the more bloody ones. So if you like surgery, it's very similar to some of the procedures that oral surgeons do because they're pretty bloody. Simple and deep pocket cleanings, root planing, crown lengthening, soft tissue, bone grafting, gingival or flat procedures, soft tissue recontouring, all sorts of stuff. They also place implants. Okay, I think it's my last specialty. Yeah, prosthodontists. So prosthodontists specialize in repairing natural teeth or replacing missing teeth. So they make dentures. They can also make crowns. They do all sorts of stuff like that. The new thing in the future, the new treatment, it's not really the future, it's happening now, is implants and then dentures that are supported by implants. So a patient could come in and not have any teeth, and they say, "Doc, I'm tired of my dentures always falling out. They're uncomfortable. I can't chew anything. I get sores in my mouth from the dentures." Well, now there's a treatment available called All-on-4s, which is basically a prosthetic appliance, prosthodontic appliance that attaches to implants on 4 implants. So basically, it's like you have teeth that snap in and snap out of your mouth, in layman's terms. Okay, so you guys, I think most of you want to go to dental school and become dentists. So there's also a couple other jobs that you can have in the dental field, like dental assistants or dental hygienists. I'll skip over that. And yes, you do have to go to school to become a dental hygienist. So if that's something you're interested in, there's lots of programs, over 300 dental hygiene programs. But I want to spend the rest of this answering your guys' questions. I hope that was a good overview. If you guys want to know more about what dental school is like day to day, please ask some questions. You guys can go ahead and ask questions right now. Here's the contact information, dentalstudentvibes@gmail.com, and also email us and we'll send you a free copy of 7 hacks to boost your dental school application. And then you can also check us out on Instagram at dental.student.vibes. You can also check out my Instagram at dr.calish. So what questions do you guys have?
So one of the questions that was asked in the chat was why you chose Leecom.
Okay, yeah, great question. So I got 5 interviews, I think. I can't even remember. 4 interviews, 4 or 5, 3, 4, 5, something like that. And they're all around. But I would say the main reason why I chose Leecom was that was the only one I got into in Florida. And I'm from Florida. I went to FSU at USF. Another thing that's very, very important for you guys to consider is the price of the dental school. Dental schools are like the most expensive professional health school you can go to. So I would definitely take that into account. Some of the other schools I would be going to were, great schools, but the tuition would be crazy. I would be over $500,000 in debt because of that. But I'll tell you the main reason I went to Leecom was because the clinical experience. Leecom, you get more clinical experience than any other school. And that, what I mean by clinical experience is actually sitting down and treating patients. You get like, I can't remember the numbers. I used to remember the numbers, but it was, you get like a couple thousand hours more here or at Leecom than at some other schools. Some other schools you only get like 500 hours. So I talked to some of my friends at other dental schools. Some of them are seeing 2 patients a month right now. Imagine that. Right now, I see a patient every single day, just about. So, and that's during COVID. During no COVID, it's like 2 patients a day or 4 patients a day. So,
All right, guys, that'll do it for our pre-dental lecture with Seth Calish, head of the Vibe Tribe, our boy. He went above and beyond, created an awesome PowerPoint for us, and we hope that everyone at USF that attended the actual Zoom call got a lot out of it. We hope you guys get a lot out of it too. Anyone in the application cycle, I'm sure this is going to reach out and it's going to touch somebody in a special way and allow them to apply and maybe give them the upper hand to get into the dental school of their dreams. So, as always, follow us on Instagram at dental.student.vibes. Let us know if there's anything we can do to help. Questions, comments, concerns, whatever. We're down for you guys. You let us know. We'll make it happen. So, as always, crazy times. Stay safe with COVID and everything. Make sure you're doing well in school and vibe on.